tactically, what we would want to do first is we just want to orient the client to the results. So we might show them either in a graph if you're really fancy, or if you're doing it old school, you might whip out that questionnaire, that paper and pencil form, or maybe both, and just tell the person what those scores mean. So you might even do some reminders about how to understand what a score of 60 might mean. So I might say something like, well, I'm noticing that, score is a 60, and that means that these symptoms are falling in the moderate range, or this score is an 80. And so that lets me know that these symptoms are falling in the severe or in the high range. So really just orienting the person to what they're seeing. And then this next piece is really where the magic of what skilled clinicians already know how to do starts to happen with measurement-based care. So the clinician just gets curious with the person next to them about their experience. And in measurement-based care, we typically would do this with a series of open-ended questions and prompts. And so because I'm a child and adolescent psychologist, I might even say something like, okay, so what's the vibe that you're getting off of these scores right now? You might say something like, I'm wondering what you think about these scores, or what, if anything, about this is making sense to you? What's not sitting quite well for you? And this is also a chance for us not just to see about where there's alignment with the person's experience. We also want to see maybe there's some places that are not quite lining up. So I might pitch a question like, what's not lining up for you? Or is there anything about this that might be surprising for you in any direction? So usually, if I were a teenager now, I might be saying something like, the process is, it's giving Goldilocks and the Three Bears, but make it measurement. So that's what's happening. We're really trying to get a sense about what's a good fit and what's not a good fit. And so really there is that chance to see about whether or not there's a not quite right element of the data. And really then again, checking back to see if it matches that person's subjective experience. So ultimately the goal is to really just try to understand and come to some sort of understanding for the person about how these data are making sense for them in their understanding of themselves, and also in their understanding of their treatment going forward.